Describing the nature of service needs. As described above, a central function of needs assessment is to develop estimates of the extent and distribution of a given problem and the associated target population. However, it's also often important for such a research to yield useful descriptive information about the specific character of the need within that population. Often, it's not sufficient for a social program to merely deliver some standard services in some standard way presumed to responsive to a given problem or need. To be effective, a program may need to adapt its services to the local nature of the problem and the distinctive circumstances of target population. This, in turn, requires information about the way in which the problem is experienced by those in that population, their perceptions and attributions about relevant services and programs, and the barriers and difficulties they encounter in attempting to access services. A needs assessment might, for instance, probe why the problem exists and what other problems are linked with it. Investigation of low rates of foreign language study by high school students may reveal that many schools do not offer such courses. Thus, part of the problem is that the opportunities to learn foreign languages are insufficient. Similarly, the fact that many primary school children of low socioeconomic backgrounds appear tired and listless in class may be explained with a finding that many regularly do not eat breakfast. Of course, different stakeholders are likely to have different views about the nature and the source of the problem, so it's important that the full range of perspective to be represented. Cultural factors or perceptions and attributions that characterize a target population may be especially relevant to the effectiveness of a program's outreach. Effective of a program's outreach to members of the target population and the way in which it delivers its service. A thorough needs assessment on poverty in Appalachian Mountains communities, for instance, should reflect the sensitivities of the target population about their self-sufficiency and independence. Programs that are constructed as charity or that give what are perceived as handouts are likely to be shunned, yeah, shunned by needy but proud families. So we have an exhibit to read it. I want to share with you. Exhibit 4H. 4H. Stakeholders have different perceptions of the problems with local health services. Telephone interviews were conducted in the in three rural Colorado communities to identify health service problems related to cancer. In each community, the study participants include healthcare providers, physicians, nurses, public health personnel. 2. Community influentials, teachers, librarians, directors of community agencies, business leaders, and 3. Patients or family members of patients who had a cancer experience. While there was general agreement about problems with availability and access to services, each stakeholder group had somewhat different perceptions of the nature of the problems. Physicians and healthcare providers. Regional facilities only accept paying patients or close down. The remoteness of the community creates a lack of service. Physician shortage exists because of low salaries, large workloads, and difficult patients. We don't have training or equipment to do high-tech care. Community influentials. People are on waiting lists for services for several months. There are not enough professionals or volunteers here. There's inadequate provider knowledge about specialized services. Patients and patients and family members. A time or two we have had no doctor here. We have a doctor here, but his patients have no money, and I hear he's going to leave. We need treatment locally. I was on a waiting list for 3 weeks. For 3 weeks before the mammography one got here. So let's continue to the passage. A thorough needs assessment on poverty in Appalachian Mountains communities, for instance, should reflect the sensitivities of the target population of their self-sufficiency and independence. Programs that are constructed as charity or that give what are perceived as handouts are likely to be shunned, shunned by needy but proud families. Another important dimension of service needs may involve difficulties some members of target population have in using services. This may result from transportation problems, limited service hours, lack of childcare, or host of similar obstacles. The difference between a program with an effective service delivery to needy person and an ineffective one an ineffective one is often chiefly a matter of how much attention is paid to overcoming these barriers. Job training programs that are provide child care to the participants, nutrition programs that deliver meals to the homes of elderly persons, and community health clinics that are open during evening hours illustrate approaches that have based uh, service delivery on a recognition of the complexity of their clients' needs. Okay, qualitative methods for describing needs. While much social research is quantitative, involving numerical representation of the objects of interest, qualitative means non-numerical, non-numerical, yes. Research can be especially useful for obtaining detailed textual knowledge of the specific needs in question. Such a research can range from interviews of a few persons or group discussions to elaborate ethnographic research such as that conducted by an anthropologists. As an example of the utility of such research, qualitative data on the structure of popular beliefs can contribute substantially to the effective design of educational campaigns. What, for instance, are the are the trade-offs people believe exist between the pleasures of cigarette smoking and the resulting health risks? A good educational program must be adapted to those perceptions. Carefully and sensitively conducted qualitative studies are particularly important for uncovering information relevant to how program services are configured. Thus, ethnographic studies of disciplinary problems within high schools will not only indicate how widespread disciplinary problems are, but also suggest why some schools have fewer disciplinary problems than others. That's right. The findings on how schools differ might have implications for the ways programs are designed, or consider qualitative research on household energy consumptions that reveals that few householders have any information about the energy consumption characteristic of their appliances. Not knowing how they consume energy, these householders cannot very well develop effective strategies for reducing their consumption. Hmm. A useful technique for obtaining rich information about a social problem is the focus group. Focus groups bring together selected persons for a discussion of a particular topic or theme under the supervision of a facilitator. Appropriate participant groups generally include such stakeholders as knowledgeable community leaders, directors of service agencies, line personnel in those agencies who deal firsthand with clients, represent, representatives of advocacy groups, and persons experiencing the social problem or service needs directly. With a careful selection of grouping of individuals, a modest number of focus group can provide a wealth of descriptive information about the nature and nuances of a social problem and the service needs of those who experience it. A range of other group techniques for eliciting information for needs assessment can be found in Witkin and Altsold. So, what do we have? A little left. Okay. Exhibit 4I. It's about sample protocol for a needs assessment focus group. A focus a focus group protocol is a list of topics that's used to guide discussion in a focus group session. The protocol should 1. Cover topics in a logical development order so that they build on one another. 2. Raise open-ended issues that are engaging and relevant to participants and that invite the group to make a collective response. 3. Care, care out manageable chunks of topics to be examined one at a time in a delimited period. For example, the following protocol is for use in a focus group with low-income women to explore the barriers to receiving family support services. Introduction. Greetings. Explain purpose of session. Fill out name cards. Introduce observers, ground rules, and how the focus group works. Around approximately 10 minutes. Participant introductions. First names only. Where participants live, age of children, which family support services are received and for how long. Other services are received. 10 minutes. Introduce idea of barriers to services. Ask participants for their views on the most important barriers to receive of family support services, like probe regarding transportation, treatment by agency personnel, regulations, waiting lists. Have they discounted any services or been unable to get ones they want? Probe for reasons behind their choices of most important barriers. Ask for ideas on what could be done to overcome barriers. What would make it easier to enter and remain in the service loop? Debrief and wrap up moderator summary, clarifications, and additional comments or questions. Any use of key informants in needs assessment must involve a careful selection of the persons or groups whose perceptions are going to be taken into account. A useful way to identify such informants are in the snowball, they call snowball approach, which described in chapter 3. More formally, in snowball sampling, an initial set of appropriate informants is located through some reasonable means and surveyed. The informants are then asked to identify other informants whom they believe are knowledgeable about the matter at use. The other informants are then contacted to ask and others. Because those persons active and involved in any matter of public interest in a community tend to know each other, snowball sampling works especially well for key informant surveys about social problems. When the process no longer produces relatively relatively relevant new names, and it's likely that most of those who would qualify as key informants have been identified. An especially useful group of informants that that shouldn't be overlooked in the needs of participants in the program and consists of a program's current client or, in the case of a new program, representative of its potential clientele. This group, of course, is especially knowledgeable about the characteristic of the problem and the associated needs as they're experienced by those whose lives are affected by the problem. Although they are not necessarily in the best position to report on how widespread the problem is, they are the key witnesses with regard to how seriously the problem affects individuals and what dimensions of it are most pressing. Exhibit 4J illustrates the unique perspective of potential service beneficiaries. Exhibit 4J. Homeless men and women report their needs for help. As efforts to help homeless move beyond the provision of temporary shelter, it's important to understand homeless individuals' perspectives on their needs for assistance. Responsible for responses from a representative of 1,200 homeless people, men and women interviewed in New York City shelters revealed that they had multiple needs not easily met by a single service. The percentage reporting a need for help on each of 20 items was as follows: finding a place to live, 87; having a steady income, 71; finding a job, 63; improving my job skills, 57; learning how to get what I have coming from agencies, 45; getting on public assistance, 42; health and medical problems, 41; learning how to manage money, 40; getting along with the family, 22; getting on SSI, 20; problems with drugs, 18; learning to get along better with other people, 18; nerves and emotional problems, 17; sorry. Learning how to protect myself, 17; learning how to read and fill out forms, 17; legal problems, 15; drinking, 13; getting around town, 12; getting veterans benefits, 9; problems with the police, 5. Because of the distinctive advantages of qualitative and quantitative approaches, a useful and frequently used strategy is to conduct needs assessment in two stages. The initial exploratory stage uses qualitative research approaches to obtain rich information on the nature of the problem. The second stage, estimation, builds on this information to design a more quantitative assessment that provides reliable estimates of the extent and distribution of the problem. Summary: needs assessment attempts to answer questions about the social conditions a program is intended to address and the need for the program to determine whether a new program is needed or not. More generally, it may be used to identify, compare, and prioritize needs within and across program areas. Adequate uh, adequate diagnosis of social problems and identification of the target population for interventions are prerequisites to the design and operation of effective programs. Social problems are not objective phenomena. Rather, they are social constructs, and can play a useful role in evaluator can play a useful role in assisting policymakers and program managers to refine the definition of the social problem being addressed by a program. To specify the the size and distribution of a problem, evaluators may gather and analyze data from existing sources such as US census or use ongoing social indicators to identify trends. Because the needed information often cannot be obtained from such sources, like evaluators frequently conduct their own research on a social problem. Useful approaches include studies of agency records, surveys, census, and key informant surveys. Each of these has its uses and limitations. For example, key informant surveys may be relatively easy to conduct but of doubtful reliability. Agency records generally represents uh, persons in need of services but may be incomplete. Service surveys and census can provide valid representative information, but they can also be expensive and technically demanding. Forecasts of future needs are often very relevant to needs assessments but are complex technical activities ordinarily performed by specialists. In using forecasts, evaluators must take care to examine the assumptions on which the forecasts are based. Appropriate definitions and accurate information about the numbers and characteristics of target populations interventions are crucial throughout the information intervention process, from initial planning through all the stages of program implementation. Hmm. Targets targets may be individuals, groups, geographic areas, or physical units, and they may be defined as direct or indirect objects of an intervention. Good target specifications establish appropriate boundaries so that an intervention correctly addresses the target population and it's feasible to apply. In defining targets, care must be taken to follow the varying perspectives of different stakeholders. Useful, con- useful concepts in target definition include çok özür diliyorum. Good target specifications establish appropriate boundaries so that an intervention correctly addresses the target population and is feasible to apply. In defining targets, care must be taken to allow for the varying perspectives of different stakeholders. Useful concepts in target definition include population at risk, population in need, population at demand, incidence and prevalence and rates. For purposes of program planning or evaluation, it's important to have detailed information about the local nature of a social problem and the distinctive circumstances of those in need program services. Such information is usually best obtained through qualitative methods such as ethnographic studies or focus groups with selected representatives of various stakeholders and observers. Key concepts: focus group. A small panel of persons selected for their knowledge or perspective on a topic of interest that allows them to convene to discuss the topic with the assistance of a facilitator. The discussion is used to identify important themes or to conduct construct descriptive summaries of views and experiences on the focal topic. Incidence: the number of new cases of a particular problem or condition that arise in specified area during a specified period of time. Means compare prevalence. Key informants: persons whose personal or professional positions gives them a knowledgeable perspective on the nature and scope of a social problem or a target population and whose views are obtained during needs assessment. Population at risk. The individuals or units in a specified area with characteristic indicating that they have significant probability of having or developing a particular conditions. Population in need. The individuals or units in a specified area that currently manifest a particular problematic conditions. Prevalence. The total number of existing cases with a particular condition in a specified area at a specified time. Compare incidence rate. The occurrence or existence of a particular condition expressed as a proportion of units in the relevant population. Sample surveys. A survey administered to sample of units in the population. The results are extrapolated to the entire population of interest by statistical projections. Not only for project. Also it says projections. And also before the last one. Snowball sampling, a non-probability sampling method in which each person interviewed is asked to suggest additional knowledgeable people for interviewing. The process continues until no new names are suggested. The last one is social indicator, periodic measurements designed to track the course of a social condition over time. So the chapter 4 was like that, and we gave some informations, of course, about detailed informations about evaluation and assessing the need for a program was the name of our chapter. And so our next chapter will be chapter 5, which is expressing and assessing program theory. I hope to see you all to watch and listen my chapter 5 as well. See you.